Endometriosis pain can present as extremely heavy and painful periods. It can present as pain with intimacy. It can present as extreme bloating, cramping, constipation. Now, a lot of times the average time to get diagnosed with endometriosis is 10 years. Women have to suffer for 10 years before they get the diagnosis of endometriosis. Endometriosis is when you have endometrial-like cells that exist outside of the uterus that cause adhesions, that cause scar tissue, and kind of bound things down from an organ perspective. Now, a healthy body, organs should ebb and flow and move, and we call this visceral motility. We want this visceral motility to happen. But when there's endometrial adhesions, then we have endometriosis and things are scarred down, they get stuck, and they don't move easily. Now, this scarring and adhesion can also embed within the pelvic floor itself. It can embed on the lungs, on the brain. There's all different places that the endometrial tissue can actually go in the body, but most of the time it does stay in the abdominal cavity and it does stay within the pelvic floor. And so working with a pelvic expert who understands where endometrial adhesions occur is absolutely epic in helping you manage your symptoms. Now, there is really fun new technology that we're using in our clinic called shockwave therapy, where we use shockwave on the abdominal cavity and on the pelvic floor itself to truly help break up these adhesions. Now, we don't have research to say that on a laparoscopy, there was this amount of scar tissue, and after we did shockwave, then there was this amount of scar tissue. That's not how it works. Laparoscopy, so the surgery that when they go in and take out the endometrial adhesions, so they clean out the endometriosis, that occurs, is usually how they officially diagnose endometriosis. And this is can be an extremely painful condition. It can also be completely unpainful, but can cause infertility. And so anyone who is dealing with infertility, endometriosis, painful intercourse, pain in the abdominal area, bloating, or constipation should come and try this therapy because it is absolutely game-changing and life-changing. When you're not bound down by this type of scar tissue and things start to ebb and flow and move, all of a sudden your motility is normal and things start to feel really, really good. And so I can't even say this enough, but we need anyone who is suffering with endometriosis to really truly come and try this technology because it is so life-changing and it's non-invasive, so there's no surgery required, there's no downtime afterwards, there's no side effects. So it's a pretty amazing technology for endometrial symptoms. And can absolutely help you on your journey, especially if you're trying to avoid things like hysterectomy, or you want to try and get pregnant naturally without IVF or IUI, or IUI and IVF have been unsuccessful. Adding shockwave therapy and pelvic floor work into your routine can absolutely help you on that fertility journey and can also help manage the symptoms. So it's very important if you have endometriosis that you have a consistent provider that you see. And we work with tons of clients that have endometriosis, and we are very skilled in managing this condition and helping people live relatively pain-free lives. Now, because endometriosis is a condition that you can continually lay down new scar tissue and new endothelial-like adhesions, then what happens is that we need to maintain that mobility. So it is something that where clients, they need once a month care to keep everything moving and keep it and be able to function because as things scar down again, then we run into pain again, or these symptoms that are caused by endometriosis, like painful periods. So I hope you found this information valuable. Please like and subscribe to our videos, and please comment below if you are interested in asking questions about endometriosis and how to manage these symptoms naturally without having to deal with maybe getting an excision surgery. Maybe this is the alternative to that excision surgery that you're putting off, because it's absolutely less invasive than that. And and there's no downtime. So I hope you found this information valuable. I'm Dr. Allison Felt. Thanks for joining me today. Take care.